I'm Steve Serra. I'm a lead WASH advisor at Save the Children, and I've also been serving as the proposal director in a Save the Children-led effort to design a climate-resilient WASH system strengthening project, which includes a large WASH and healthcare facility component in Lao PDR. And this project is meant to be funded by the Green Climate Fund. So I'm going to give a crash course in the Green Climate Fund. And then I'll also do a quick deep dive into the WASH and healthcare facility portion of our proposal. The Green Climate Fund has two unique roles of applying entities. The first is an accredited entity. These are pre-qualified partners who are able to apply to the fund to access money and lead proposal design and implementation of projects. So if you're consider them the prime implementing partners. They also have what's called nationally designated authorities, which are the government ministries or institutions that serve as the interface between the country government and the fund. The fund allows you to apply in various levels. So you can apply for programs that are less than 25 million, less than 50 million, or it goes even further beyond that. But each accredited partner or entity is accredited with a cap. So for Save the Children, for example, we're not allowed to apply for more than $50 million projects. Those accreditation levels also come with other stipulations. For instance, we aren't allowed under our accreditation status to do any large-scale infrastructure work. We can only do small infrastructure and rehabilitation work. The Green Climate Fund has two broad programmatic areas. One is that they fund mitigation activities, which are designed to reduce the greenhouse gas emissions across the world and improve the capacity of carbon sinks. And the other type of program are adaptation activities, which is obviously to improve resilience to the impacts we've already been seeing due to climate change. And those adaptation activities are the ones I'm going to focus on. There are four types that you can see listed on the slide that are funded through the fund. And one interesting thing to note is that while the Green Climate Fund has many projects on ecosystems, resilient infrastructure, livelihoods, and food security, they have not yet funded any programs in health. So this project, if it's funded this year, will probably be the first funded health project from the Green Climate Fund. They have an intense focus on funding programs that are in least developed or small island states, especially for the adaptation components. And our proposal is a smaller funded proposal. It's called a simplified approval process proposal, which is capped at $25 million. It's going to be a 5-year implementation period, and it will work across 25 highly vulnerable climate change districts in Lao PDR. We're working directly with 100 healthcare facilities. Most of them will also receive infrastructure work, and we're also working with 250 communities through the program. So for our program in Lao, we are the prime partner along with the Ministry of Health. The Ministry of Natural Resources and Environment in Lao is the nationally designated authority. So they're the approving authority within the government. Our core partner on the program is WHO, and we're also getting technical assistance from Healthcare Without Harm. The program has 4 outcomes. I'm only going to focus intensively on outcome 3, which is where the WASH and healthcare facilities work lies. Outcome 3 is about improving service delivery through supporting better infrastructure at the healthcare facility, but also building the capacity of the healthcare workforce. I'm just going to focus on one output within our third outcome, which is the one that's hyper-focused on WASH and healthcare facilities. And before I go into the 5 activities that are under this output, I just wanted to mention that the UN Green Climate Fund they really scrutinize your proposal designs to make sure that everything that's being proposed is linked to a climate problem or a climate solution. And so in Lao PDR with our program, we wouldn't have been able to include the wash and healthcare facilities components without WHO having completed a national wash fit assessment of the health facilities across the country. They actually did the assessment in, I think, all 1,200 plus health facilities within the country, and they included the new climate questions in that assessment, which gave us the data we needed to justify including this work to the Green Climate Fund. So this outcome includes 5 activities. One is that we're working with Healthcare Without Harm's GHG emissions tool to assess the extent to which the health system in Laos is emitting greenhouse gases. The next one is about making healthcare facility infrastructure improvements to just the general shell of the health facilities to be more resilient to flood, drought, and extreme heat. The third activity is around strengthening electrical services to be more consistently reliable and more energy efficient and climate resilient. The fourth activity is about upgrading the wash services within climate vulnerable healthcare facilities so that the wash services are reliable and also resilient to flood and drought. And then the fifth activity is about strengthening the capacity of the Ministry of Health, NAMSAAT, which is the WASH department under the Ministry of Health, and the private sector partners engaged in this work to more effectively operate, maintain, and monitor health facility infrastructure moving forward.